Welcome to Heart about everything lupus, where we discuss everything about lupus. I'm Susie Eagles Flight from Lupus South Africa and Andrea's Gift Foundation.
East is east and west is west, and the wrong one I have chosen.
Today we are talking about hydration. It may be easy to forget, but water is the most important and essential nutrient for the human body. Good hydration is important for everyone's health, but it's especially critical for those living with lupus. What is the relationship between lupus and hydration? Stay tuned and I will explain.
Keep on wearing those frills and flowers and buttons and bows, rings and things and buttons and
Lupus and hydration. Why is hydration especially important for individuals with lupus? There are several reasons. Many common symptoms of lupus are made worse by dehydration. This includes fatigue, joint pain, muscle aches, and skin conditions. Proper hydration is vital for healthy kidney function, and since lupus nephritis is a serious concern for those with lupus, staying well hydrated may help prevent kidney damage. Those with lupus are often more sensitive to temperatures that change, and adequate hydration increases the body's ability to regulate temperature. Dehydration can also affect the immune system itself, making it more difficult for the body to fight infections. And some lupus medications can have side effects that affect the body's ability to balance fluid, some causing water retention and others increasing dehydration. It's very important for our lifestyle. As with food, we need to increase our hydration. It's just as important as changing your food. And just those things, changing your hydration, your lifestyle, food, diet, and doing some exercise will definitely improve your lupus. This means that those living with lupus need to maintain a healthy water balance. How are we going to do that? Stay hydrated and maintain a healthy diet with proper electrolytes. Suddenly, we can lose that balance, and then it can induce a lupus flare and other illnesses too. So, you must stay hydrated and with enough electrolytes, and you have to change your diet. In today's world, there is no more excuses to be living healthy, making healthy food choices. Avoid hot and dry weather conditions. Maintain a healthy exercise schedule. Just as I said, it's very important. Stick to a healthcare provider's treatment plan. Otherwise, worsening symptoms and even organ damage may be the result. It's very important. I mean, you don't want to damage your organs. You need them, especially when you have lupus. So it's very important to stay to a healthcare treatment plan. I know it's difficult, and a lot of lupus patients, I have seen it over and over again, skip medication, stop taking medication, um, you know, and it's very important. You cannot stop the treatment plan. It will just throw you in a flare, or you will not get into remission or even have good days. How can hydration affect lupus? Dehydration, according to the Mayo Clinic, is when you use or lose more fluid than you take in, and when your body doesn't have enough water and other fluids to carry out its normal functions. And we don't always realize that or see it. You must make sure that your daily fluid intake is enough. And even if you have blood tests done, if you are dehydrated just a little bit, you don't even notice it, then there is a problem to get veins in your hands. So stay hydrated and hydrate even more so when you go for blood tests. Dehydration is bad for anyone, but for those living with lupus, it can be particularly damaging and affect quality of life. Just like I said, it will affect the quality of life if you stay hydrated. Symptoms of dehydration include thirst, dry mouth and dry eyes, fatigue and sleepiness, dark colored urine and stress on the kidneys, headaches and joint pain. I know a lot of warriors struggle with headaches and migraine. Maybe had dehydration problem, and dizziness and confusion. Each of these can add to or even mask similar symptoms caused by SLE. In order to track and manage lupus triggers and evaluate a person's disease state accurately, it's important to limit the largely avoidable complications that can be caused by dehydration. So, yeah, it can influence your disease, and it's important that you are hydrated when a doctor takes a look at you or you have blood tests, and it can limit complications as well. While dehydration does not cause lupus nephritis, it can certainly aggravate it and even increase the risk for tissue damage. The kidneys need healthy blood in order to work properly. And dehydration not only can affect the blood flow and volume, but it can also affect the concentration of antibodies and electrolytes to the point that the kidneys are unnecessarily stressed. It's way healthier to have more water in your symptoms for your kidneys. Proper hydration is also critical for healthy mouth and teeth. Dental problems is an issue with us. Lupus itself and the medication and Sjorgensen syndrome affects our mouth and teeth. So stay hydrated to protect your teeth and mouth. It's common for those living with lupus to have mouth sores and to have increased risk for tooth decay. It's widely understood that the gut microbe can affect and perhaps even trigger lupus in some people. So your cultures in your gut can trigger a lupus flare. And we know that because most of us struggle with gut issues. That is why I always suggest warriors to take a probiotic every day. Hydration is even more important for lupus patients who are also suffering from the overlap disease, Sjorgen syndrome, and autoimmune conditions that affect the glands that produce mucus in saliva and tears. So those glands um, don't produce tears and saliva as much as they need to when you have Sjorgensen's. And that is a problem for your eyes and your mouth. If you stay hydrated, it improves. I go nowhere without my cup with water. The persons with Sjogren's may feel like they are constantly dehydrated, requiring hydrating medication such as lubricating eye drops. How much water is enough? The usual recommendations is 8 glasses per day. More specifically, the Mayo Clinic recommends 11 cups a day for women and 15 cups a day for men, though it also depends upon the physical exertion and body type. If you have a very busy job and working hard, you may need more water. But a cup is traditionally believed as 250 milliliters. So it's a quarter of a liter, 1 cup. And women needs 11 and men needs 15. The amount may need to increase in patients who are suffering from nausea and diarrhea or are pregnant or breastfeeding. Just listen to your body. It will show you when it needs hydration. But if you have Jorgensen's, walk with water with you all the time. Rehydrate you can buy from your pharmacy. It's the best to take if you need electrolytes when you are nauseous and have diarrhea. The rehydrate packets that you buy from a pharmacy that you make mix with water. How lupus can affect hydration. Fluid retention. Lupus can actually cause fluid retention, and in turn, this can lead to swelling of the legs, ankles, and abdomen, tightness in the skin, increased appetite, less frequent urination, and sometimes difficulty
Let's
swallowing.
go where I'll keep on wearing those frills and flowers and buttons and bows, rings and things and buttons and
How
bows.
does lupus cause fluid retention? Inflammation causes localized swelling, edema, and can create systemic electrolyte imbalances. Kidney damage can lead to swelling in many parts of the body and particularly lower extremities. Some lupus medication can also cause water retention, such as plasmaquine, which is hydroxychloroquine, corticosteroids like prednisone. What can be done to help prevent fluid retention? Number one, adjusting your diet, in particular, reducing the intake of salt while increasing vitamin B, magnesium, and potassium. You can take magnesium as a supplement. Potassium, you only take when a doctor suggests you take it. And vitamin B6, you cannot take it as as a supplement. You have to add food choices to your diet. Non steroidal anti-inflammatory medication, NSAIDs, can also help. Sometimes diuretics like Lasix and hydrochlorothiazide may be prescribed. That's if you have um, very bad edema, but only when the doctor prescribes it. Electrolyte imbalances. While lupus is not thought to cause dehydration, it has been associated with water and electrolyte imbalances, in particular low potassium levels, hypokalemia, low sodium levels, hyponatremia, and issues with the blood pH. These are usually detected in normal blood tests, relatively easy to treat, and are more often caused by medication than the lupus itself. Tips for staying hydrated. So, staying hydrated is very important. There are many easy ways to do this, including simply drinking plain water throughout the day without additives and in healthy quantities. There are even apps on your smartphone and watches that can help you keep a schedule. It's the only way for me to know I drink the correct volumes. Drinking other fluids can be helpful if they are healthy for the individual, such as juices, milk, and tea, and some sport drinks, Pedialyte, and other beverages with electrolytes. Juices can have too much sugar, but there are ones with natural sugars. Some sport drinks, this is not quick fixes like Red Bull and Monster, and that is unhealthy. Pedialyte, and then also the Rehydrate, those ones has enough electrolytes in. Avoid excess alcohol, coffee, and other beverages that can lead to dehydration. Yes, alcohol and coffee causes dehydration. There was a time a while ago that my Jorgensen's was so bad I couldn't drink a cup of coffee because if I take a sip, my whole throat is dry. So I had to stop drinking coffee for a while. Healthy exercising, meaning not overdoing it, because the moment you overdo it, your body wants more water. And remembering to replace the electrolytes that might be lost by sweat. managing your temperature and dealing with humidity. Stay cool on hot days and even use humidifiers indoors if necessary to keep your skin from drying
Scared
out.
said I'm a homespun, but I love you longer, stronger, where your friends don't tote a gun.
Ways.
My
The relationship between lupus and hydration is surprisingly complicated, and there are still more to learn. How, however, it is clear that there are many important reasons for those with lupus to stay properly hydrated. It is critical for supporting the healthy kidney function, relieving several lupus symptoms, and helping manage the side effects of certain medications. I know if you are hydrated and eat good meals before you take your medication, a lot of the side effects can be eliminated. Good hydration also prevents the effects of dehydration from masking the symptoms and triggers that can lead to a lupus flare and tissue or organ damage. Staying well hydrated is definitely achievable. However, it takes some diligence and it needs to be part of the patient's overall lupus treatment plan. It's part of your treatment plan, as if healthy eating, taking your medications in the morning, taking medication in the afternoon, eat before you take medication. It's just as important as that. The water intake is also on a meal plan and even on health trackers, etc. For this specific reason, just like diet, it is so important for warriors to hydrate. So, yes to staying healthy and hydrated. Go drink your 11 cups
that
of water.
shows, and I'm all yours in buttons and bows. Give me Easter.
This concludes this podcast. Please review it on the platform you are listening on. Leave a comment below on the topics you would like us to talk about. If you enjoyed this podcast, please hit the like button below. Follow us on Facebook and Instagram and TikTok, and subscribe to our YouTube channel. Andrew's Gift Twins and Teens, Lupus South Africa, and Susie Egglesfly. Thank you for listening, and remember, giving up is not an option. Bye.
Oh.